Welcome to the Lentil Intervention Podcast, talking all things movement, whole food nutrition and environmental wellness with your hosts, Ben and Emma.
Hello everybody and welcome to episode 6. My name is Ben Adelberg, coming to you from Auckland, New Zealand, and as always I'm joined by my co-host Emma Strutt from Boona in Queensland. Welcome, Emma.
G'day Ben, hello everyone, hope you're well.
Yes, very good, and hope our listeners are too. So let's crack straight into it. Who are we talking to today?
All right, well, I'm excited about this one. Today we've got Dr Portia D'Anverrs coming on. She's a radiologist registrar. She's also a qualified fitness instructor. In the past, she's actually competed in powerlifting, in INBA bikini and sports modelling. So she really kind of walks her walk there. She's also the Tasmanian ambassador for the health promotion charity Doctors for Nutrition. And she really passionately advocates healthy living, not just for physical health, but for mental health benefits as well. So it should be a really good convo to get into, and I'm looking forward to it.
What a CV, and cannot wait either. So we've had to get our clocks aligned with different time zones, thinking Hobart would be pretty straightforward with New Zealand, Queensland. But no, Portia, welcome to the show. You are currently sitting in Perth, Western Australia, the complete opposite end of Australia.
G'day there, guys. Hey, Ben. Hey, Emma. Yeah, thanks so much for having me. Yes, I'm all the way over in Perth, which feels like an island because we're so separated from the rest of Australia. But yes, it's a lovely place to be. A bit stormy, a bit cold in the last couple of days, but no, gorgeous Perth.
No, awesome. So, Portia, as Emma's just read out, you've got quite a little bit of a story to you in terms of expertise and experience, and it seems like you've got quite a few passions on the go. So tell us a little bit about yourself in terms of, you're a radiology registrar, so why did you get into the medical, sort of scene? And where does plant-based fit in all this? So very open-ended question, but yeah, how did this all start?
Sure. Well, I guess for me, I'll start from the very beginning, which is probably the more interesting part of how I became plant-based. I was born on a remote cattle station out in the middle of outback Queensland in a place called Banana, which is a couple of hours sort of west of Rockhampton. And it was a big cattle station, about 3,000 head of cattle on a very big block of acreage, and my dad was a cattle farmer, and we had big processing, meat processing sort of business going on. And I worked out on the farm and helped castrate and dehorn and brand all the calves, did a lot of mustering and horseback riding and just country life really out in the middle of nowhere. And then when I was about 10 or 11, I saw my high school, or my teacher, my English teacher, outside this new place called Subway, and she was eating what she said was a veggie burger. And I'm like, what is a veggie burger? She's like, instead of a meat patty, you have a veggie patty. And I'm like, what?
The fact that they sold veggie patties in the middle of the outback has already got me.
I know. And I'm just like, I can't believe... how can you not have meat in a burger? And she's like, I'm vegetarian. And I'm like, what's a vegetarian? Anyway, Pam was my idol, and I decided as soon as we had that conversation that I'd be a vegetarian too, at the age of 11, which of course didn't make me popular with my family, who were, meat and 3 veg every single day kind of people. But then I did start seeing animals differently at that point. I saw the calves that we were castrating and dehorning and branding with no anesthetic. I saw them as the same as my dog or my cat. And why do we have these different standards? And then I also saw that the people who ate a lot of meat out in the middle of central Queensland, they tended to be more rotund, have quite a few health problems, high blood pressure and diabetes. And then I sort of just became vegetarian, progressed into vegan at university, but I didn't know a lot about nutrition, and nutrition wasn't well taught or heavily taught in medical school at all. Maybe I think we had 4 weeks out of 6 years on nutrition and metabolism. And then as I got through uni, I started doing a lot more fitness as a stress relieving sort of exercise. Studying was very stressful. University and medical school was very stressful. So I started using exercise as a bit of a means to, relieve that stress as a bit of a hobby. And I guess I did a bit of bro science nutrition and, was on the whey protein. At that time I was a vegetarian. And then I started realizing that what you put in your body really does affect your output in the gym and how strong you get. And then slowly just increased my self-learning on the internet and that sort of thing in textbooks. And then I guess as I got older and had a bit more space and a bit more time, I was a junior doctor, didn't have as much stress of exams. I decided I would really pursue this passion for fitness and nutrition and actually get some qualifications in these things, just for my own self-learning. And I realized that there was this whole body of doctors that were really passionate about nutrition and well-being and preventative medicine. And I decided that was something I wanted to become involved in. And so eventually became involved in Doctors for Nutrition, and felt this huge support system with these guys who were just really passionate about evidence-based science and how that mixes with nutrition and preventative medicine. And so that's kind of how I got to where I am now, I guess.
Gosh, what a journey.
I know. It's exhausting.
So let's start off with a little bit with your profession, your actual medical profession.
Sure.
So radiology. Do you start off with more a sort of a basic medical degree and then move on to specializing in radiology? Is that pretty much
exactly right?
Yeah.
So back when I was a girl, which I feel quite old now that I'm approaching 30, but back when I was in medical school, it was a 6-year.
You're ancient, God.
I'm starting to see fine lines and wrinkles. So back when I was at medical school, it was still a 6-year undergraduate degree.
Right.
At the moment, most medical schools are postgrad, and it's about a 4 to 5 year degree. But back when I was in uni, it was 6 years. So we did 6 years of medical school training. Then you become a junior doctor, which the first year is called an intern. Mm-hmm. And an intern, for want of a better word, is a glorified shit kicker, in the nicest possible way. That is the year that you're doing all the paperwork, you're doing blood forums, you're assessing patients with low acuity problems, and then on night shifts, you're assessing patients with high acuity problems that you feel very out of depth for. And then you respond to your resident or your registrar. So the next year you become a resident, and all of this intern and resident year are very general. So you'll rotate through surgery and emergency and general medicine. And then once you sort of go through a few rotations over those first 2 years, you decide what you do like and you decide what you don't like. And so at that point, some junior doctors will decide, hey, I really love emergency medicine. I'm going to go down that route. And they'll start trying to get onto an emergency medicine training program. Or they might decide that they like surgery, or they might decide they like medicine. So they're the usual 3 streams. And then the radiologists are the weird ones to the side that don't really fall within emergency medicine or surgery. It's this sort of complete other specialty, which just focuses on medical imaging, which includes X-rays, MRI, ultrasound, and CT, as well as some nuclear imaging studies. So after those 2 or 3 first years of just being a general junior doctor, rotating through different specialties in the hospital systems, then you need to apply to a radiology training program, which is a centralised college in Australia. And to be selected to be part on that radiology training program, it is incredibly competitive, unfortunately. There's maybe between 50 and 70 applicants per job. And so it's pretty cutthroat. You you always need anatomy courses and physics courses. You need research presentations. You need to have presented at several conferences. You need to have done a lot of workshops and online courses. And you need to have had some more senior level general doctor practice as well. So most people would have been a registrar prior to being on a radiology program, like a general medical registrar or surgical registrar. So it does take quite a lot of time to be accepted onto a radiology training program. But in the long run, it makes us better doctors, because when we are assessing those scans and writing the reports for the scans, we have a better idea of what the doctors requesting the scans need to know from the images, and how those images and how our interpretation of the images will change that patient's management. So, it is competitive to get onto the radiology training program, but it is for a good reason. And once you're on that program, it takes 5 years of training and going through different subspecialties within radiology to become a radiologist. So the reason why I'm in Perth and not in Tasmania at the moment is because Tasmania doesn't have its own specific paediatric hospital, and therefore we can't really get the specialised paediatric radiology exposure in Tasmania. And so Tasmania sends me to Perth, which has a specialist paediatric dedicated hospital that I can spend 3 to 6 months at to get that paediatric radiology experience. So that's why I'm in Perth, and I'm really, really enjoying paediatric radiology. It's very, very rewarding. Yeah.
Oh, that's good. That sounds like an insanely busy workload.
I'm exhausted. I'm exhausted.
Just listening to it.
Yeah,
Sorry,
exactly. Oh, but good on you. Well done. I mean, congrats on how far you've come so far already.
Oh, I appreciate
absolutely.
that. Yeah, a lot of people don't understand, when I say I'm a radiology registrar, they're like, oh, radiographer. Oh, that's nice. I didn't realize they were doctors. I'm like,
Oh, you know what? I'm
Really?
sticking my hand up. I did not know that. And Emma
Yeah,
will
no.
attest to that, because
Yeah.
I even I don't get it. But thank you.
No.
You've clarified.
So
for
one
a lot of
person
us.
is the photographer. So the radiographers are these very skilled people that get the patients into all sorts of strange positions and take the x-rays or the
I am very
ultrasounds or the
familiar
CTs.
with that part.
Yeah.
With all the crashes and injuries I've had.
All the crashes.
I'm
Yeah.
good. I'm good at that part. Yeah.
So that smiley face that took those x-rays of you, that lovely person who took those x-rays, they're the radiographer.
Yes.
And they go through about 4 to 5 years of university training themselves, but they are not doctors. But they're very, very good at, taking those very specific angles and, knowing about radiation and radiation dose and that sort of thing. Whereas the radiologists, they wouldn't have a clue how to take a picture. If you put them in front of a CT scanner, they would not know which button to press. So we're very dumb at taking pictures, but we are we're very good at interpreting those pictures. And so we have quite different roles. Yeah.
Yeah.
And that's a very important role too, because oftentimes you'd be the first person to, diagnose someone with
Exactly.
a life-changing, Yeah.
We're
So that's gotta
often
be
the
tough.
very first person, to, make that diagnosis of cancer or make that diagnosis of, a bleed in the brain or, a bleed in the abdomen. That's us.
So do you see with your, obviously that's your profession, it's your passion, but also with your passion and growing understanding and appreciation for, a whole food plant-based lifestyle, with what you do you see there a real potential for a link? I mean, when we talk about a GP, sure, they see patients, you can make lifestyle type, sort of provide advice in the sense of, instead of this medication, change your lifestyle. But in your line of work, do you see there as a unique opportunity to bring the two together, perhaps more from an educational point of view, from what you see and what you experience?
Absolutely. People really respond to visual information.
Yeah.
A GP will be able to say your cholesterol is elevated and, here is your a blood level of X, hormone. But people who are not medically trained do not understand necessarily those numbers and reference values. Those numbers mean very little to the usual, the standard population. Whereas a picture if you show a cross-sectional CT image of a healthy person with low adipose tissue, with low subcutaneous fat or low visceral fat, and you see how all the organs are nicely, snugly tucked in together, there's very little subcutaneous fat surrounding, that person's abdomen or surrounding their heart, and then you show them a CT picture of someone who is morbidly obese or who has high lipids or has type 2 diabetes, and you can show them, you see how this liver, see how dull it looks, see how all of that change and attenuation of that liver is actually fat infiltration, and this big ring of white around the heart, that's all fat surrounding the heart. And then all of this white stuff in between all of your organs on the slice of your abdomen, that's all fat surrounding the organs of your abdomen. People will be able to see that stark difference. Obviously, you wouldn't want to go and irradiate people with a CT scan just to show them this information. But if they're having the CT anyway, I think there is possibly, we don't do it in hospitals. This isn't something that we do in Australia, but it is possibly something that could be looked into as a visual aid for patients, I think.
Yeah, well, a picture speaks 1,000 words, doesn't it?
It really does. And it's something that you can measure. So we can measure this subcutaneous fat or the fat amount in the abdomen or the fat surrounding the heart. We can see atheromatous calcium plaques in the vessels of the heart, the coronary arteries. We can sometimes on X-ray, we can see calcification in the arteries on people's legs, which is quite amazing. Like you take a picture of their knee and you can see their calcified popliteal artery posteriorly behind the knee. It's quite amazing. But we don't tend to report this information. Why? Because this information is not something that can be acutely changed or is acutely needed by the ordering doctor. The doctor's ordering the X-ray to rule out a fracture or to rule out a bleed in the abdomen or to rule out a malignancy in the abdomen. And all this extraneous information about their adiposity or their visceral fat or their heart calcification is of negligible importance in that very acute setting when they're in for query cancer or query bleed or query heart attack. And that information gets lost and it's not reported on. But
it's such a huge opportunity, though.
It is.
I'd be so really fascinated because, you always talk about, when you talk about diets and people on various types of diets and say, but look at that person, they're skinny. But, and what you try and explain is, it could be water loss. It could be other reasons why they've lost the external, why they're weighing less. But what you don't see is the internal, you don't see the visceral fat. And here is an opportunity to truly demonstrate, someone's actual health.
It's a lost opportunity potentially. And I think in the States they're doing it, but unfortunately it opens the gates to some clinics irradiating, doing whole body CTs to for people who want to pay a certain price to get all this information on themselves. And is there a benefit of that radiation dose if that information isn't used wisely? And if we ended up doing a whole bunch of whole body CTs on the top 1% of the most wealthy people in the population who can afford it, are they actually getting a benefit, or is that radiation dose over time going to lead to an increased risk of malignancy in that population group? It's an unknown. Whether they actually get information, make lifestyle changes, or detect enough pre-malignancy states to intervene and make that radiation dose negligible in terms of the harm, it's something that I think the debate is still out on. But I think if we're taking the CT or we're taking the X-ray or we're taking that information anyway for a different reason, it would be great to one day implement that extra, lifestyle modification or modifiable things in that CT or in that X-ray to say, hey, look, we just noticed that you had this cardiac calcifications. This is something that could be worked on with your GP or your dietitian, and could be reversed with XYZ, lifestyle change. I think that would be of huge benefit and might reduce that patient's presentation down the track for, cardiac or diabetic or, atherosclerotic presentations. And I think that could definitely give the patient benefit without giving them increased harm. Yeah.
But then that depends on the GP themselves, whether they're that way inclined, looking at lifestyle measures, but maybe it's like when you get your blood test done, you tick the boxes, of what you want tested. Maybe it's this scenario where,
that's a great idea.
A client's coming to you
Yeah.
and they actually say, look, you're going in, would you like to know about this, and this? Because we can add it on. It's the same scan, but we can get additional information back. I don't know, easy
That's
idea.
a really
but
good idea.
There's obviously a massive process to implement and to explore.
I think it is an excellent. Yeah, it's something that I'd really love to do. Even I was thinking in the public setting, could we give a questionnaire out to people who are already getting CTs and ask them about their dietary choices and their current level of activity, and then give them the option of, would you like feedback on lifestyle modifiable factors after your CT? And have that additional report. I think that would be
a
fabulous.
fantastic initiative.
Yeah,
absolutely. Because even if you're just planting that seed, that could have a massive flow-on effect.
Exactly. And then, also getting their permission to see, would you mind if we used your de-identified data to show any correlation between, activity, nutrition, and the findings on your CT? Obviously, it's something that would need ethics, and it would need, quite a few people over time to get a good snapshot of the population. And we probably wouldn't see many plant-based people. I was thinking of doing this some years ago and getting ethics approval and whatnot for it. But I was just thinking, how many plant-based people do I see in Hobart that would be getting whole body CTs at that hospital? It'd have to
all
be
the crazy
quite...
cyclists that.
You know what? If you assured me of safety, I'd sign up, because I'm fascinated. It's what you can't see. I just see a massive opportunity here. Honestly, you're far deep into this, but man, imagine you could link it all up. It's like you say, people are visual, and here you are the person that can present that visual information.
That's it. Yeah.
Yeah.
Well, it's cooking in the back of my mind, and once I've sort of worked out the ethics of it and got a supervisor on board, watch this space. We'll see.
We'll get you back on for part 2. But now, look, with all the stuff that you do see, you've spoken about calcification, visceral fat, all sorts of other ailments that you see yourself. Is there something that stands out as the most common, or something that stands out as, damn, why am I always seeing this, but it's such a simple thing to avoid, or to, is there something that stands out that you see that's worth mentioning?
Yeah. Absolutely. It's got to be obesity. Whether it be, so this is in the adult population, obviously it's different in pediatrics, and lifestyle change is less, or lifestyle related diseases, fortunately, less of a problem in the pediatric population.
Although, are you seeing a shift though, based on, say, textbooks, from 20, 30 years ago to what you're seeing now? Are you actually seeing a shift in pediatrics?
There are certainly some children who have a weight that is higher than recommended and is causing orthopedic problems. We definitely see that. But I'll probably talk more about the adult population if that's all right. It's
absolutely.
Probably what my knowledge is better in at the moment. In terms of the general population, obesity, I think, is around about 60% in Tasmania. And this is something that is so preventable and so easy to treat. I mean, it's obviously difficult to promote change and to implement change and to have that change long term for people and to have their habits altered. But it's free, it's easy, and just by implementing a whole food plant-based diet, most people will lose weight and will have, a healthier body composition after, 3 to 6 months. I think there are multiple research studies that show that.
Well,
by just
episode
going
3
whole food.
and 2 and 3 of our podcast, Dr. Luke Wilson,
Fabulous.
we spoke about the broad study, and there you have it.
Yep,
After 3 months,
there you go.
huge results.
It really doesn't take long, and you don't have to calorie count. These people, they're not obese because they're bad people or they're doing, they're trying to be. It's because nutritional literacy is not something that's well taught or ever taught in schools. And if it is taught, it's taught off potentially a wonky food pyramid that has a few things in there that probably shouldn't be in there, that are in there for financial reasons rather than actual health reasons. And I'm sure Emma could talk to you more about that. She's the guru in terms of those things. But yeah, nutritional literacy is at an all-time low. Diabetes and just obesity is just so prevalent and causes so many issues that it just makes me so sad, because these people, we produce poorer pictures on people who have a large amount of subcutaneous fat because the ultrasound waves cannot actually get through the subcutaneous fat to be able to see the fetus or to be able to see the liver or to be able to see the kidney. We can't see the pancreas in some people because the sound waves can't actually penetrate through the 10 centimeters of adipose tissue prior to getting to the pancreas. And then when we do see the pancreas, it is the same consistency as the adipose tissue surrounding it because it's completely fatty infiltrated. And then the patient gets grumpy at us because we write in the report, can't, acquisition or study limited by patient body habitus. We haven't been able to actually see the skeletal structure of your fetus properly because the ultrasound waves get too impeded by the fat between the probe and the fetus, and therefore we can't rule out spinal abnormalities or cranial abnormalities. So it really puts this person, and potentially if they're pregnant, their baby at a disadvantage from the get-go, just because we can't get that information to help them. And our poor sonographers, I don't know if this is appropriate to mention, but our sonographers, they all ultrasound with their right hand pretty much. Some of them are on sick leave because their right shoulder is so sore because they have to contend with 10 centimeters of adipose tissue and push it, into such a position so they could see the organs underneath. That the strain against their right shoulder has caused them rotator cuff injuries. And so it frequently will have sonographers who are off because of this problem. It really puts the patient at a disadvantage throughout their course through the hospital. The beds have to be changed. They're at higher risk of DVT. They're at higher risk of infections. They have, obesity as a risk factor for cardiac disease, for stroke. It really does. It is at the base of a lot of disease.
It's wide-reaching, isn't it?
Yeah, it really is. Yeah.
Yeah. Gosh. Okay. So much to think about.
It's incredible. Yeah. And the amount of times that we write cannot, study image quality reduced by patient habitus. Is probably maybe 30 to 40% of our studies that we do in ultrasound, maybe even 50%. Yeah, we're not getting that information for the patient because of that barrier of adipose tissue.
Yeah. But when it comes to health and fitness, like, you absolutely walk the walk here. So you mentioned before that you're involved with Doctors for Nutrition, but also that you've got a background of competing. And you were already plant-based when you did, your powerlifting comps and your bikinis.
Yeah, it was. Yeah.
So that was all to do with stress management, was it?
Pretty much, yeah. When you're
throwing weights around the gym.
Yeah.
It's amazing what just moving your body can do in terms of stress relief. I mean, there are so many different ways to reduce stress. But for me, I guess it used to be running. It used to be a bit like you, Ben. I used to love running. Mm-hmm. And then I was diagnosed with this strange thing called popliteal artery entrapment syndrome, which is where your calf muscles get too big and they squish off your popliteal artery.
Wow.
And so
Okay.
I was claudicating at about 1 kilometre into each run, and which means you get ischemic foot pain because your feet have no blood supply and they start screaming out in pain. And so I had to stop running. And so I needed a new activity to become obsessed with. So I chose weightlifting. And weightlifting, as you know, you can sort of choose which muscles you want to hypertrophy versus the ones that you don't. And so I just started weightlifting and not using my calves. And so all of a sudden my calves shrunk down, which was great. My feet stopped hurting. And I was, on my way to starting this new hobby in weightlifting. And then after a while, a few people said, oh, you should compete, you should give it a go. And I decided, oh, why not? And at the time I was juggling a lot of, external stressors, just getting by as a junior doctor, had family members who are unwell. My nana had ovarian cancer and another family member had metastatic lung cancer, and I was a radiotherapy registrar at the time, which is the doctors who zap the cancers with radiation to try and make them smaller. And I was on the same team that was working to try and zap the tumours in my uncle. So it was all very confronting. I was working at Lismore Hospital and my poor uncle had metastatic lung cancer with lesions in the brain. And the doctor I was under, the radiation oncologist, he was the treating radiation oncologist for my uncle. It was all very stressful, conveying these messages of, disease, life expectancy and palliation to my family, who weren't medically trained, and trying to be that conduit between the radiation doctors and my family, etc. And knowing how much to tell them and how much not to tell them, and is truth, just being honest, the best policy, all of these questions. Anyway, I was very stressed. And so I decided I needed some me time. And my me time was that 1 hour in the gym. So for that 1 hour, I'd just be completely selfish. I'd listen to whatever music I wanted. I'd just focus on, my gym workout. And the other thing that I do is just focus on, really good food. And I just did that for 3 months. And then all of a sudden I had this bikini body that was ready for a competition. And I thought, why not? I'll do it. And so I did it. When you say competitive, I compete, but I'm not really competitive compared to all the other beautiful people on stage. I think there's a difference between competing, having a foot in the game, and actually winning that game. And I was nowhere near,
So participating is a nicer...
I think that's a better... I was in the glittery suit on the stage, but by no means competitive in terms of, first, second, or third. So I think I probably came second to last. But I had a bloody awesome time. And the whole process was, the focus and dedication that you need to on your food and on your well-being and getting your steps in and going for that daily walk, and that time at the gym. They're all opportunities to have your me time. And that's what I really, really needed outside of work and outside of the stress of my poor uncle and my nana at the time. And so it just gave me that permission to, have that selfish hour every day. Yeah. And at the end of it, I had something to work towards, and I had this great time, made some great friends, had a great relationship with my coach at the time who, helped me get into that competition and become comp ready and whatnot. And so I just found it a really positive hobby to have on the side. Of course, some people take it too far, or it creates more stress, and they find the whole thing of competing and working out and eating well quite stressful. But for me, the other stresses were 10 times more stressful. So I actually found it quite therapeutic, I guess.
That's a really positive mindset to have.
You talk about food and the importance of food with the competing, and I'm really keen to delve a little bit deeper here now.
Sure.
One reason, because this is one area of sport in general that I have pretty much no experience in. And At this stage, you were plant-based. You weren't vegetarian anymore. You had already progressed to being
That's
plant-based.
right. Yeah.
Did you cop any flack for that from the others that you were training with?
No. I picked a whole food plant-based coach, Amanda Fisher, and she's this beautiful woman. I believe she's still based on the Gold Coast, and she now has a young family, and she helped me go from being an idiot vegan, who just
So a more typical vegan rather than a whole food plant-based.
I mean, not that, there are idiot vegans. I mean,
basically eating anything that was deemed vegan, not necessarily whole food based.
Exactly. Yeah. So,
and why did you go to her? Was that because you already acknowledged then that, okay, how am I going to get my protein? Was that something already?
Yeah, absolutely. I had this misconception that vegans could not put on muscle. That was my thought back then. That was my belief, and
which is still a lot of belief for most people. So
I mean, you took it up because you had too much muscle, really, in your leg.
Yeah, pretty much. Pretty much. But yeah, I had this. I was just the pretty much the junk food vegan. I have tomato sauce and spaghetti, and that was vegan, and I was happy with that. But I didn't have that deep nutritional knowledge. I was vegan for one. I knew that vegans were generally thinner and had suffered less obesity and type 2 diabetes. That was my general vague impression, but I didn't know how to do it well at all. I just knew that, one, I wanted to do it for being a peaceful human and not hurting animals, and two, for the environment, and three, that I knew it was probably generally healthier, but I didn't know how to do it well, and I didn't know why it was healthier. So I wanted to do this competition, and I wanted someone who was, fairly knowledgeable in the area and who had done it before. So I found Amanda, and she coached me through, I think it was maybe 8 weeks or 10 weeks or 12 weeks. And the results were just astounding. So she helped me understand nutrition better, how to use the calories and feel full on the calories, have enough calories, how to have enough protein. And we just went from, I was never overweight, but I was certainly had a little bit of blubber. I had that nice little poochy belly and the poochy love handles and, a nice amount of jiggle, and there was nothing wrong with my body before. But, we can always strive to be fitter and healthier and happier. And in terms of happiness and health, I was stressed. I was stressed out of my tree and was probably not eating the best at all. And so she helped me transform from being a little stress head, not knowing anything about nutrition, to knowing a lot more about nutrition and managing my stress a lot better and putting that stress energy somewhere different, by working out in the gym, getting those walks in, and eating well. And so then after at the end of those, I think it was 12 weeks, we did a competition together, and it was an amazing experience. I made my own bikini, and I loved it. Yeah, it was great. And then I decided, hey, I want to be an Amanda to someone. Amanda helped transform my life around. I want to have that knowledge myself. I want to be more knowledgeable as well, and maybe even help someone else like Amanda helped me. And so then I did courses as much as I could throughout my spare time, and then did that personal training courses as well, and yada, yada, yada. Yeah.
Just to go back on two quick things, because it's the most common thing I get asked when I present at workshops and expos, and then I always get the big muscle boys generally, and some girls. How do I bulk up? What foods should I bulk up? So you mentioned calories. What would be your go-to sort of key foods that you would use to ensure you're getting the calories, basically?
Yeah, sure. It's so funny. I've got a lot of great friends who are guys who, I've encouraged slowly to become a little bit more plant-based, and they say, as soon as I started being plant-based, I was so tired all the time and I had no energy. And I'm like, it wasn't because your protein sources were different. It wasn't the lack of meat that was making you tired. It was the lack of calories.
Yeah.
So the thing that people don't understand is that vegetables and fruit, lentils and, chickpeas and those sorts of things, they have so much fiber. They're so filling. And people don't understand that by accident, you will be reducing your calories a lot unless you're keeping an eye on it.
That's right.
For people who weight train or who expend a lot of energy, exercising, or particularly men, I mean, females can definitely fall into this category as well. I don't want to be, splitting it too neatly into genders, but I find that it's probably more of an issue in men is they really need to focus on keeping those calories at their, maintenance, at their TDEE, I think. So the best way to do that would be to have some really great healthy carbs in there. So chickpeas are great, lentils, some brown rice, quinoa, those sorts of grains. Adding in, more calorie-dense fruits like bananas. Some calorie-dense fats are also good to have in. So I love adding peanut butter, coconut. Stay less away from the refined oils, because you can get all those calories through non-refined things as well.
That's right.
But if you really, and then guys can go to town on things like sweet potatoes and pumpkin. It's just about keeping your mind on the calorie side of things. So hit those calories first. Then my second, this is all for people who are well, not for people with medical problems who are trying to change their diet. That's all and there's expertise. But for people who are well, who are just trying to go more plant-based, one, hit your calories. So find out what your calories are on your current omnivorous diet, and then go to plant-based and then hit those same calories with the plant-based diet, and make sure about 50% of those calories are coming from carbohydrates, which will keep your energy levels high. I think a lot of people, might forget to put a bunch of fat in there or a lot of oils and feel sluggish and not necessarily have that energy because they've reduced their carbs by accident. So keeping those carbs high. And then your next goal would be to meet those protein needs. And I think 0.8 to 1 gram of protein per kilogram is usually a pretty good goal. For weightlifters, they can often go up to 2.2 grams per kilogram. As long as you've got normal kidney function, it should be fine. I think it's quite hard to get that high of protein on a plant-based diet, and it's not actually necessary. A lot of people think you need really, really, really high protein to put on muscle mass. I'd say that a nice easy number is at 1 gram per kilogram, and you probably are going to be absolutely fine.
Yeah. Well, generally by increasing your calories, then by default you're increasing your protein intake. So that's
absolutely
a lot of people will be getting that without even realizing.
Correct.
Exactly.
I mean,
I
generally talk about that 1.2 to 1.7, which similar to the figures you've given. But again, it's without needing to get caught up in numbers. Just nice to put some numbers and reference it, but then say, but hang on. But if you increase your caloric intake, and your plate is average 70-80% carbs and 10 to 15 fat, 10-15 protein, again, without thinking,
you're
just
going to
because
be getting there.
you've ticked the boxes, so
exactly.
And what's your thoughts in the I call it the strongman's game, the weightlifting, the body sculpting and all that, in terms of boosting. I mean, you just touched on it now, but the obsession of boosting the protein intake, because I need protein to build muscle, You
absolutely need protein to build muscle. You need protein to do a lot of things, and just for general cell repair. Our body's, it's an essential macronutrient for a reason. Sure. But what we need generally to have that extra energy for our body to say, hey, we're safe, we've got a time of plentifulness now, let's use this extra energy and these extra macronutrients that we're getting to put on protein, to put on muscle. You need to be in a calorie surplus. So it would be your total daily energy expenditure plus 10 to 20%. So it's necessary to have small excess in calories to be putting on that muscle. So that would probably be the first thing. Then you need a muscle stimulus. So we need a stimulus to that muscle to create those micro tears. And then we need something to go in and help heal that. So that is the protein. And then we need something to give us the energy to heal that. So that's the carbohydrate. So we need all of those things all together to create this, anabolic environment, I guess. And so I think the slight energy excess, very slight, is about 10 to 15% is all you need above your total daily expenditure. Adequate protein, which is, about that 1 to 1.5, 1.7 grams per kilo, and some healthy carbohydrates to give you the energy to do the exercise that's needed. I think that, is going to build you up for success.
Well, you're living proof that you've it doesn't matter where you come. I mean, it's like with all the athletes I engage with, for you to be on that start line, or for you specifically to be on that stage, that's a tiny percentage of the whole population, and it's still an incredible amount of dedication and commitment to get there and compete and put yourself in contention. You're living proof that a good whole food plant-based diet with a broad range of fruit, vegetables, legumes, starches, grains, etc. will give you the physique that you need to be up on stage and give it a good go. So
that's absolutely right. Yeah.
And I've got to ask here, because oftentimes when I talk to people about whole food plant-based diets, they go, no way, I don't have the time. That's way too intense, like too much work in the kitchen. I just can't get that done. But like your schedule is insane. So do you have any, do you have any top tips on how people can, fit this into their busy lives?
Absolutely. I think the first step I would make to transitioning is just to make your next grocery shop plant-based. So you don't need to throw everything out in your whole house that has an animal product in. I mean, you can do that if you want, but you don't have to do that. To transition, just make your next shop, your next purchase more conscious. Pick more veggies out. Do some simple swaps. Swap out, the animal-based milk for a plant-based milk, and just slowly create these different shopping habits to have more plant-based options available in your house. Then it's less of a huge black and white transition. So I think that would be the first practical step that I would make to people. The next one is prepare in advance. So behind every good, a lot of us, how should I say this right? People see these beautiful bodies on Instagram or in bodybuilding competitions, and they wonder, how did they get there? How did they create such an amazing physique? They created that physique by preparation, by knowing what they're going to eat before they eat it. And so a lot of these people will meal prep. And, meal prep might sound really over the top or, a little bit too obsessive. It's just bloody practical. It just makes the week ahead so easy. If you batch cook, a thing of lentils, I made a chickpea and tomato and enoki mushroom soup last night. If I made 4 times as much of that and I put it into 8 different containers and froze it all with a nice portion of quinoa, and I'd had 8 meals that I made just for the one dinner that I cooked. You've got 8 meals for the next week ahead already made out. And
Absolutely.
So that's what
less washing up. Hallelujah.
Less washing up. So that's what I would do. So on a Sunday, I'd spend, you're making that Sunday night dinner anyway. Why not make, quadruple the batch? So instead of just putting 1 can of chickpeas, put 4 cans of chickpeas, 4 cans of tomatoes, and then have your dinner serving, but then just freeze the rest of it into 7 different containers. Then you've got your meals your lunches for the next week already ready in the freezer. And so that next Monday morning, what I do when I'm getting ready, I get my breakfast, eat my breakfast. I have put my frozen meal on the bench put it in my bag, and then I head out the door and you've got your lunch for the day. So meal prep just makes it so easy. The next one would be you don't actually need to cook. Back when I was doing all my comps, well, actually, I lived in a tiny house for a while. I had one of those portable camping stoves, like gas stoves, and that's all I had. And you can find a lot of ways that you don't actually need to cook. So maybe you get a bag of spinach, put a quarter into your bowl, half can of chickpeas, put some nice tomato relish, put some nice basil in there, a bit of nooch on top, and then cut up maybe some cucumber or some capsicum, some balsamic vinegar, and then you've got a salad that you didn't even need to cook. So it doesn't have to be complicated. Over time, you just learn to have a protein source, have some greens, have something that makes it taste good, which might be a wee bit of pepper or some balsamic, some sort of condiment that you might like, and then mix it together. Not every meal needs to be perfectly gourmet. It just needs to be, healthy and nutritious and something that you don't mind eating. And so that was kind of how I did it.
Yeah, 100%. That's fantastic advice.
Yeah. We think it all has to be perfect and beautiful and fancy, but really it can be just as easy as getting one of those pre-prepared salad mixes from Coles or the supermarket, putting half a can of chickpeas, some sort of nice condiment that you like, and some chopped up veggies, even some fruits you can put in there, and you're done. It's
not everything has to be Insta-worthy.
Exactly, yeah.
No, look, meal prepping is the biggest thing, like you say, and I always tell people it is a pain in the butt. It does take time. You might spend up to 2 hours in the kitchen, including washing up, but the second you take a bite out of that meal later in the week, you are grateful for it, because it's either that or some poor choice you have to make, when you have to buy something out, whether there's limited options or whatever the case is. So it's like everything else in life, isn't it? I mean, if you want a result, you've got to put some kind of commitment in, but they're not as regular as people think. You don't have to come home every night or every morning. It's like, oh, what am I taking? It's this meal prep concept is the game changer.
Yeah, it is. And that 2 hours of focusing on making those meals is a lot less than the time that you'd spend at the cafe lining up, and the time that you'd spend cooking every night over the week, and the time that you'd spend, trying to reheat or cook something in your lunch break, trying to hunt down a Subway sandwich. It's a lot. That 2 hours is just much more time efficient way to have, about 21 meals prepared. And so and also, you think for those 2 hours, you don't need to think for the next of the rest of the week.
Yeah,
so if you sort out, you don't need to be actually as calorie focused as I was when I was comp prepping. But for me, just working out my calories, my meals for those 2 hours, sorting them out into containers, that is the only time I had to think about calories for the whole week. And I knew if I just followed and ate those meals, I'd be on point. My protein would have been met, my micronutrients would have been met, my calories were met. And if I just ate those meals for the rest of the week, I knew that I'd come in tighter and leaner and more comp ready by the end of the week than, it was just granted, because it's already worked out for me. So, I mean, that's taking it to the bodybuilding sort of level, but you can certainly, use that for a more general lifestyle as well. You just have to do it for that 1 to 2 hours on a Sunday, and the rest of your week is just so much more streamlined, so much easier. And if you are aiming for weight loss or, fitness goals, by just eating those meals that you've thought of and prepared for that afternoon, you're going to be so much closer to your goals by the end of the week, with hardly any thinking.
Absolutely, because it provides structure there as well, which is really important for weight loss. Yeah.
That's it.
Just as a side note, I don't understand how you stretch your meals out to 8 days. I mean, for me, it'll be 4 days by the ingredients you're putting together. So by the sounds of it, I have double portions of what you have.
Well, you go
You
on very
probably
long
do. I sit on my ass. Radiologists are known to just sit on their butt for 8 to 10 hours a day. So it's potentially a different
so you'll be
lifestyle.
very well across the concept of endothelial dysfunction and the need to move, wouldn't you?
Oh, it is so important. I mean, my shoulders and my hip flexors, I am in that crouched, hunched over, seated position all day. And and you can tell other office workers just by looking at them, because their shoulders are rounded, their neck is, hunched over like like a vulture. And, they've got these tight hip flexors and they can't activate their glutes.
Yeah.
They just do not know how to activate glute medius or glute maximus. You ask them to do a leg extension, they use their lower back. It's this office worker, physique. And exercise is just so important. Moving our body in some way every day is just absolutely so important to our health.
Do you incorporate any little sort of movements during the day? I mean, you talk about by the end of the day, but when you sit for prolonged periods to get those hips, the hip flexors, the glutes. I
pretty much get up every hour from my desk, and I think I probably get grumpy stares from other colleagues who probably think I'm slacking off, but I just have to. I have to stand up, stretch my legs, go to the kitchen, make a cup of tea, do
Absolutely.
a lap around.
And it would make you more productive as well.
I think so. It makes you less sleepy. Means you're getting in some oxygen.
Well, you're getting the blood flow.
But
so
absolutely, that's it. And I have been known to bust out a yoga move in the reporting room, doing some warrior 3 poses, and we're made to move. Our bodies are just made to move, and whatever it is, how small it is so important. And for people, the first thing I ask them to do is just to somehow monitor their steps, just as it's a nice objective way to get a feeling for how much they move on a day-to-day basis. And some clients, when they started up, were on about 4,000 steps, and I would get that within 5-6 o'clock most days during my general day. So they have a very low just general mobility. That would be around the amount that you would spend just walking around the house from the couch to the toilet to the kitchen a day. And we do need to move our bodies a wee bit more than that, for the amount of calorie-dense foods out there. It's no wonder that people are overweight.
It's the disconnect.
When it is. One burger or one thing of chips, the small fries from Macca's, has the same amount of calories that they burn all day. So if they eat that and a burger and some Coke and their breakfast and their lunch, they're already about 3 to 4 times over their daily expenditure because their movement is so low. Just moving our bodies, getting around that 8,000 to 10,000 steps a day would be a great start to increasing your health, but also how much you see of the world. It's beautiful going outside and, seeing different people's day-to-day habits and, getting to meet people in the streets and exploring a neighborhood, feeling the fresh air, smelling different things. I think, it's a great way for people to just get out and enjoy their surroundings as well.
Portia, you have been an absolute breath of fresh air, and in the sense that firstly, for me personally, you've completely opened my eyes up to the world of radiology. So thank you for that. And I'm sure a lot of our listeners will be very appreciative of learning about a whole world that we're not as exposed to be fair. So, I guess our knowledge.
We're out in the back. We're the little Santa's helpers in the background that no one gets to see.
You are. And then I'm always back in the waiting room like, when are they going to give me that report? Have I got a fracture or not? But you're an inspiration. I mean, the amount that you do, but also the amount that you're a living sort of, I don't know what the word is, but you demonstrate the fact that everything is possible, super busy lifestyle, wanting to push your body as well to its limits. You need the energy level, you're working super long hours, and you can do this on a whole food plant-based diet, which but does it give you enough energy? Does it give you enough calories? No, you've busted all those myths. So thank you. It's
welcome.
Yeah, it's been an absolute pleasure to have you on the show.
Well, thank you so much for having me. It's so great to connect with you guys intercontinentally and from the other side of the planet of the country. So yeah, thanks so much for having me, and thanks for sharing such a great resource to so many listeners.
Thank you for listening to the Lentil Intervention Podcast. If you found this interesting, make sure you subscribe and share it with your friends.